I am glad I saw you today. I have got a question about the prostate.
Shoot.
When do I need to get mine checked? You know, the prostate.
Probably starting at age 40 or so. You'd need a rectal exam and a PSA to begin with. If both of those are normal, then you'd repeat that yearly.
Can my family doctor do that for me?
Yes.
I've heard that prostate cancer is a disease of old people. I have also been told that men seldom die of prostate cancer.
Well, yes and no. Men in their 50s are diagnosed all the time. I would not let other people influence you negatively with bad information and keep you from getting the exam.
Somebody told me once that if men lived long enough, almost all of them would eventually get prostate cancer. Is that true?
That is partially true. You need to begin having prostate exams when you are in your 40s, because some men develop prostate cancer at a young age and die of it quickly. Did you know that?
I did not. I thought most people died with it, and not of it.
That is actually true, but also misleading. 1 in 6 men will develop prostate cancer. Over 250,000 men are diagnosed in America alone. Of that, about 25,000 die. So there are men out there dying of it every day. Ever heard of Frank Zappa? He wrote that "Don't Eat the Yellow Snow" song. He was diagnosed in his early 50s and died 3 years later.
Yes, I have heard of him. He had a bad lifestyle, and that is probably why he got it.
Actually, lifestyle has nothing to do with prostate cancer. Some think that a high-fat diet peculiar to industrialized nations may contribute to prostate cancer.
But I don't smoke and I don't drink alcohol.
That is irrelevant.
I have no voiding symptoms. I mean, when I pee, I have a good stream, can hold my bladder for hours and don't get up at night. If you had prostate cancer, a male would have voiding symptoms, would you not?
Because prostate cancer usually starts well away from the tube that goes through the prostate, the prostatic urethra, it is uncommon to have urinating symptoms in the early phase of the cancer. If you go to the doctor because you are having problems peeing, then you went too late. This is probably the #1 reason some men are diagnosed with prostate cancer too late to cure.
Nobody in my family has any type of cancer, and specifically my father does not have prostate cancer.
Heredity is a risk factor, but not having a family history doesn't mean you won't get prostate cancer. Being black is a risk factor both for having prostate cancer and being diagnosed with the more aggressive form.
Luckily, I have had a colonoscopy and it was fine. That would have checked my prostate. Am I correct in thinking this?
No, that test checks your colon. With that procedure, you only see the rectal lining, or mucosa, where it covers the prostate. You would not see or examine the prostate with colonoscopy. That is actually a different organ. You make my point about men in general, and why they make bad patients. They take a specific misconception about prostate cancer, and then apply it incorrectly with broad strokes. They then make decisions based on the wrong information for the wrong reasons. The male further complicates the early diagnosis of prostate cancer because they do not like the idea of having a rectal exam.
Judging by the size of your hands, if you were my urologist, I'd have concerns about a rectal exam too. Do we know what causes prostate cancer?
Other than the risk factors I just told you about, the only thing common to men and prostate cancer is testosterone. Testosterone contributes to prostate cancer, and is also the reason why a male's prostate can enlarge as he ages, and why you can have trouble voiding as you get older, and it is not related to prostate cancer. Monks that have been castrated don't get prostate cancer.
Prostate enlargement and difficulty voiding can be a normal and doesn't mean you have cancer. Trouble peeing can often be a consequence of just getting older.
That's right. You can have a big prostate and terrible problems peeing, and it is just because of the natural enlargement of the prostate. To varying degrees, all men will experience some symptoms as they age.
God had quite the sense of humor when it comes to males, wouldn't you say? The prostate gets bigger as we get older and causes trouble, and the other organ down there we wish would grow actually shrivels up and then quits working. Go figure.
Did you know you can have a very small prostate gland and have an aggressive prostate cancer, and then have a very large prostate and not have cancer? When it comes to the prostate, size does not matter.
What about the PSA? I have heard that it is an unreliable test and probably should not be ordered by doctors in the first place.
That perception is partially true as well. The PSA can be elevated and a man not have prostate cancer. In fact, probably only 20% of men with an elevated PSA will have prostate cancer. But, if the PSA did indeed help you find that 20%, then I feel it makes it a worthwhile test. If the odds of something happening to you is 1 in 100, and you are that one, well, that's 100%.
Will prostate cancer always be associated with an elevated PSA?
No. You can have a low PSA and have prostate cancer. You can have an elevated PSA and not have prostate cancer.
I'm confused. And then on top of this there is that pesky rectal exam. Just the name of it is unpleasant and brings to mind pain. Why not just skip the rectal exam and just do the PSA?
Because sometimes there is prostate cancer and the PSA value is normal. You have to do both. Have you had a rectal exam?
No. I don't cherish the thought of it either. I was going to say that I didn't need one because I am having avoiding symptoms, but I know better now. What about that rectal exam? Is it really that uncomfortable?
No big deal. Takes about a minute to do, and usually the prostate exam and the PSA can be done with your regular yearly exam seamlessly.
What would a prostate feel like if one had prostate cancer?
These are good questions. Well, this is tricky too. The prostate feels like the thenar eminence, which is the soft pad of muscle below your thumb. The gland should be smooth without irregularity or bumps. They call bumps of the prostate nodules. It is possible to have prostate cancer with a completely normal rectal exam, which again makes the point of doing both the rectal exam and the PSA test.
Would you have trouble doing number 2, if you had prostate cancer?
No. Not unless the prostate cancer was very extensive.
How did Frank Zappa find out he had prostate cancer?
What happened to Frank Zappa unfortunately happens to thousands of men yearly, and this is the category of patients that the doctors are trying to find with prostate exams beginning when a man is in his 40s.
So, what happened to him?
He probably noticed that his urinary stream was not as good as it had been, and probably had some bone pain that he thought was arthritis. When he finally went to the doctor, the cancer was probably already in his bones. Prostate cancer spreads to bone, and when someone presents at this stage, it is uncurable. It is a sad situation, and yet so preventable, if we could just get past all of the male issues related to early detection.
Who are some other famous people who have had prostate cancer?
Bill Bixby, Dan Fogelberg, Robert De Niro, Harry Belafonte, Colin Powell, James Brown, Desmond Tutu, Dennis Hopper, Bob Monkhouse, Robert Frost, Langston Hughes, Charlie Wilson, John McHugh, Andrew Lloyd Webber, Quincy Jones, Louis Farrakhan, Rudy Giuliani, Johnny Ramone, Lawrence Olivier, General David Petraeus, Norman Schwarzkopf, Timothy Leary, Tiger Woods, Father Phil Lesh of the Grateful Dead, Arnold Palmer, Nelson Mandela, Joe Torre, John McEnroe's father, Tony Savalas, Stan the Man Musial, Louis Gossett Jr., Clark Howard, Bob Dole, Linus Pauling, Stokey Carmichael, Eldridge Cleaver, and John Kerry, who served in Vietnam, Merv Griffith, and the godfather of soul, James Brown.
Wow.
Wow is right. Now it may be abundantly clear to you that prostate cancer is not as one-dimensional as you may have thought, and why myths, misconceptions, and half-truths delay the diagnosis of prostate cancer in men when it is most treatable. Remember this as it pertains to prostate cancer: if you live by rules of thumb, you will be all thumbs.
So let me see if I have this right. I will try to describe the male you are trying to educate and make more aware. The male that doesn't want to finger up, as you know what, and then have to pay someone to do it. The male who won't get his prostate checked because he has no prostate symptoms. Lifestyle doesn't matter, but being black and having a relative with prostate cancer does. Colonoscopy doesn't check for it. It can be diagnosed in old and young men alike. It can kill and it can be slow growing, but the only way to tell the difference is to have a rectal exam and PSA together, not one or the other. Well, how did I do?
Very good.
One last question. Can a male check his own prostate like a woman can check her breasts?
You can physically feel your own gland by contorting yourself, but then you would not have the experienced finger necessary to tell if your exam was normal or not. Let's leave that one to the doctors, my friend.
Well, I am glad I ran into you. Thanks for the information. I am off to make an appointment with my family doctor, and I will be sure to be a proactive prostate patient and be sure that the rectal is done with the PSA.
Good for you. Just remember, the rectal exam is a procedure that the male does not want done, and the doctor easily persuaded not to do. Hey, I like that. A proactive prostate patient, that is what prostate cancer awareness is all about.
You can learn more about prostate cancer at theprostatedecision.com. Again, for you proactive prostate patients, the address is theprostatedecision.com.